Hi, good evening. And today is just me from IIDR. Let me first introduce myself. I am Dr. Sophia Libratis, and I've been the program director. I still am for the last 2.5 years for IIDR. I've done my dentistry from Keli Institute of Dental Sciences, Belgaum, and I have also done my implantology in 2017. I worked in Africa for 5 years under Colombia, Africa, and then I came back to Mumbai and I joined IIDR. So let's not wait further and we'll start. So, this session is exciting because I know that I'm going to have a lot of doctors on board after this. So, I am really keen. So, this is not some knowledge bartering wala session. It is about to let you know how our platform works and how you can be a part of it. Okay. So, learn, educate, and earn. So, as you know, we are a global platform. We are not just tending to pan India. We are committed to continue dental education, okay, and also clinical excellence. So as the program director, I am proud to lead a community of professionals who aim to elevate dentistry worldwide. So, through our online programs, we provide accessible, high quality learning opportunities. Whether you are an experienced clinician or just starting out, IIDR supports your growth with structured, evidence based content curated by experts. So, this is what we are about. So, let us start. So now, how do we partner for global excellence? Okay, we are an online platform and we conduct continued education courses, whether they are in the form of offline workshops or our webinars. Our webinars, like you know, are solely for knowledge exchange. So they are free to attend. I always encourage all our doctors to attend this as much as possible. In fact, I even stress on the fact that you can come up with topics that you are interested in knowing about, anything new that is in the system in the market that you want to know, and we will have it out for you. And these sessions are free, so why not? So now through IIDR, we are going to go global as well. Okay, your courses will be also launched globally. So that is what we are looking to do. And by keeping your content out, your courses, you are also contributing towards patient care, not just to doctors in India, but as mentors, as speakers through doctors all over. Okay. Now, why do we need global collaboration in dental education? I mean, we are good enough. We have our own clinical practices. It's going very strong. Why do we need it? See, today we live in an era where dental technology and clinical practice is evolving faster than ever. So this brings us to the first key point, that is rapid advancements. Okay, breakthroughs in dental materials, equipment, digital workflows, and treatment protocols are happening globally at a rapid pace. Okay, so to stay relevant in the system as well as competent as dental professionals, we must continually update our knowledge. Okay, this makes timely, accessible education more important. We need to have access to this kind of education. Now, next we see is a growing demand. What is growing demand? We see for specialized dental training. As patient expectations rise and procedures become more complex, dentists are actively seeking opportunities to upskill. Whether it is mastering implantology, whether it is aesthetic dentistry or surgical techniques, clinicians all around the world are looking for quality education that goes beyond basics. I mean, we all know that. We have all been in a situation wherein we wanted to upgrade ourselves at some point in our careers, whether it is in aesthetic dentistry, whether it is in implantology, whether it is in whichever field of dentistry. It could also be something as how do you uh, go ahead with a publication of your article, even journal publications. We do not have any idea. So there is need for specialized dental training, and we need to be those kind of professionals. That is why we need this collaboration. All right. The next is, but there's a major challenge as well, that is bridging disparities. What happens is access to dental education is not equal everywhere. While some countries have cutting edge facilities and resources, others lack basic infrastructure. I mean, we know that. This creates a global gap in clinical competence and patient care. So, how patient care? Because if you are not clinically competent, your patient care is going to be compromised. We all know there are certain universities wherein we do affiliations with them and we feel that they are better while giving courses, their fellowship programs, and we would all love to be a part of something affiliated with a foreign university, or even in India for that matter, not just foreign universities. So that's where our global collaboration becomes essential. IIDR plays a key role in closing these educational gaps by connecting experts, resources, and learners across borders. So, by sharing knowledge globally, we not only enhance individual careers but also uplift the overall standard of dentistry. I mean, obviously, if you are upskilling yourself constantly, there would be an improvement in your clinical practice and how you deal with your patients, how you document your cases, and whatnot. So, yes, we definitely need this global collaboration. Now, what are the global collaboration opportunities with IIDR? Now, this slide we are outlining how educational institutions and professionals can collaborate with IIDR. Why? To amplify their global impact in dental education. Okay, so maybe a different university has got different contributions to provide, so that which is not available in India. So let us have a collaboration and also have lots to take home too. You can join courses. It is not necessarily you have to contribute as a mentor. You can also learn. So we are also having this initiation wherein the mentors on IIDR will have access to the content across our platform. So what happens is you tend to learn as well as you're contributing to the platform. Now, we begin with course development. Through this initiative, institutions can co-create online courses and specialized workshops with IIDR. Okay, this is not just with individual doctors, but it is with institutions as well. This allows for what? Pooling of expertise, expanding curriculum offerings, reaching learners far beyond geographical boundaries. So not necessarily we have to do everything in Mumbai. It can be collaborated with IIDR, with a university in Delhi, maybe in Chennai, maybe in West Bengal, maybe in northeastern some state. So yes, it is everywhere. Okay, we are looking to have this everywhere. Next, we have faculty exchange. This program encourages mutual learning by allowing faculty members from different countries, members from institutions, to share knowledge and best practices. We have already been doing this in the form of our webinars, but it is going to be more elaborate. We are going to have international doctors and speakers on this platform wherein who will contribute to different kinds of courses wherein you can learn from those courses also. So it is about building academic bridges and broadening our perspectives, right? Now, the third pillar is student opportunities. Now, IIDR helps create platforms where students can benefit from mentorship, guidance, and even international internship programs. So, we are coming up with affiliations with international universities, wherein if you do a workshop with these affiliations, it gives you different kind of credibility, your practice, what you learn, because our curriculum will be combined with international curriculum as well. So you will have more to learn from a different perspective, from a global standard. So this is what it means. Okay. And finally is our research projects. Now, IIDR also encourages collaborative research and publications. Okay. By partnering on evidence-based studies, institutions can contribute to global dental science, enhance your credibility, stay at the forefront of innovation. So, in short, this says that partnering with IIDR isn't just about a one off activity, it's a long term, multi-dimensional collaboration which will enhance our teaching, learning, research in dental education worldwide. The research project is under the wraps, but we will come forward with it in a couple of months. Okay. Now, moving on. Why should dentists create content? We are not digital bloggers like we see on Instagram. Why do we need content creation? Now, creating and sharing content, whether it is an article, whether it is video, whether it is webinar, it position you as a thought leader, okay, in your area of expertise, be it implantology, be it cosmetic dentistry or endodontics. It builds trust and recognition among peers patients, and academic institutions. Let me tell you a small one-off incident. It's we had a doctor on our platform. She has spoken. She's a periodontist, and she had contributed not just on our platform, on other platforms as well. But let me tell you, she has bagged a patient consultation in her city because of her online presence, because of how she contributes. Because nowadays people are very digital savvy. They want to know doctors who they have an idea. Okay, she knows her subject. She is really good. She is a consultant, and that is how she bagged her patient consultation. So see where it gets to you. You need to be digitally present for today's age. Now, the first thing is you establish authority, like I just mentioned. If you are in your niche, if you become a speaker, you are establishing authority, I just explained. Then second is we educate and inform. Now the more we learn knowledge, any knowledge is never a waste. The more we learn and we share with our colleagues, we share with our patients effectively. They'll also be happy to know that doctors are abreast with latest developments, techniques, different kinds of materials, products. So this is how we educate and inform. Next is expand your reach. You increase your professional influence and network. So how do you do that? A strong content presence increases your visibility beyond your clinic or practice. You reach newer audiences through social media, through blogs, YouTube, webinars, or your podcast. In fact, I don't know if you all are aware, the speakers on a platform on the YouTube IIDR channel, we have put small snippets of all their webinars on YouTube. So you can go and check it out. So you get a personal branding as well. So you're already out there. Now, last is your new opportunities. What is this? Through thoughtful content always opens doors to invitations for conferences, your dental speaker programs, product reviews, or academic collaborations. Media platforms and industry brands often seek professionals with an engaged audience. Always need a doctor who is very socially present, digitally present. There are so many distributors in the market. They're coming up with newer equipment, whether it's a laser machine, whether it is composite material, whether they are cartridges, whether they are impression material. They definitely are coming up with so many new products. They want a speaker, a mentor who can be digitally present, so they have more access to newer audience. So you see, this is just the beginning. It is going to get you definitely there. In fact, media platforms and industry brands, they seek professionals, and these professionals always attract 30% more online inquiries through blog posts, through these kind of collaborations. So you build a wider digital presence. Okay, it just improves your clinical practice. Now we move on to the next slide. Now, what does this program offer you? Like, why would you want to do this, right? Now, this is, it illustrates the journey of becoming a global instructor with IIDR. So first step is you join our faculty. Okay, we are always looking for dental professionals who are passionate about teaching and want to make a global impact. I have had an incident wherein 2 years back, I had a student who was in a final year of MDS, and she wanted to talk about bone grafts, which was a very new research topic. And yes, we did give her the chance. We collaborated with her as well, and she has already been a speaker on our platform now. She is practicing successfully there. What I'm saying is we are giving that opportunity to not just doctors who have passed out or who have an MDS degree. It is open for everybody, for any dentist. So once you're on board, the second step is getting recognized. IIDR provides the platform. It provides visibility. It provides credibility. You have your own personal brand on IIDR. So basically, you have an entire page that is dedicated to you as a doctor. Okay. So you will be having to help you stand out as a leader in dental education. All right. Then third comes your content creation. You will be supported to develop engaging and effective digital learning materials, whether you have lectures or clinical demonstrations to interactive modules. You will be guided by our team. We have our graphic designers on board, we have our marketing agencies on board, we have our backend team, the website development team. So you don't have to worry about the technicalities. Okay, you just have to worry about your content and what are you going to talk about. Also, your content will reach a global learner base. Like I said, we are globally established. We are under affiliations with foreign universities. So definitely through our platform, your knowledge impacts dental professionals across borders, expanding your professional reach. Finally, you engage in live events, webinars, virtual classrooms, and panel discussions. By interacting with doctors off and on, you can have a live event, you can have a workshop arranged. We are open to workshops, with doctors, with men who want to mentor students. We are definitely, uh, we encourage that. So this will give you a step towards that. Okay, so you can have real time interaction with learners, whether it's online, then you have globally, or whether it is offline, whether you have it at a center, two centers in India. So this journey, will not just to teach, but to grow a personal brand. It is, we want you to contribute meaningfully to dental education. Okay, and then you can be on the global network of doctors. Now, next, moving on. Now, what are these steps? Okay, this slide represents progressive journey of growth and success. Okay, an ideal visual metaphor. So what does it mean? Each colored step, it symbolizes a phase. Okay, we start at the bottom with red. We begin with initiation, the point where a student or a doctor or professional takes the first step, perhaps by joining a course, a community, or beginning your clinical practice. I'm sure you are already there, you are already part of our groups, you have already having your clinical practice. So initiation has already happened. Next, the step comes is the orange, that is your learning. You apply to become a speaker, wherein your foundational knowledge is built through education, your training, your exposure to real world challenges. It's about acquiring the skills that will support everything to come. Now, the yellow is for application. You just have to start creating and sharing, right? You start putting knowledge into action, right? Whether you are in clinic, you are in classrooms, or whether you are in research, or you are in a platform like this. Today it is IIDR, tomorrow it will be some other platform, right? So this is just the beginning. Probably you can have your trial and errors here, right? So it's where theory meets practice. So this is where we do application. Then comes mastery. We move on to green, wherein you refine your expertise. Okay, you develop your confidence and start becoming known for your capabilities. You are no longer just learning, you're leading in your space. So this is where we come with mastery. Now your blue signifies visibility. At this level, your work is being noticed. All right, you have reached, suppose now you contribute to our courses, you will start reaching at a level of blue, right? What does it mean? You may start speaking at events, you may start publishing research, you may create content or mentoring others. All right, you become a reference point for others in your field. So finally, we have the purple, that is leadership and impact. This is the pinnacle, because where you are not just participating in your profession, but you're shaping it. All right, whether by driving innovation, influencing policies, or empowering next generation, your role becomes transformational. So this staircase should remind you of the growth. That is a step by step journey. Nothing happens overnight, doctors, nothing happens overnight. So while the climb is very challenging, every level brings you closer to that purple step. So success and greater impact. Okay, now moving on. What would we give you as a platform? We would give you resources and tools. All right, we would give you templates for presentation and videos. Okay, they are ready to use, very easy, professionally designed marketing materials. Okay, you have pre-made banners. You save your time. We just ensure your content is polished, engaging, and aligned with best practices. So you just worry about your content, we deal about the aesthetics of everything, right? So whether you are a seasoned speaker or a first time creator, our tools are here to support your journey. So we are definitely here. And this is access to detailed guides to help you with content for maximum clarity, engagement, and reach. Again, you don't have to worry about the marketing, that is our owners. Now, moving on to the next slide. This is a very short presentation, so I try to put in everything that you should know. Now, so our speaker program, right, is designed to support you every step of the way. Okay, we offer training to help you become effective communicator. Okay, whether you are teaching online or in person, you will receive guidance in creating high quality content. So be it a video lecture or written literature. Okay, you will also be featured on our platform and connect with a vibrant community of dental creators. Okay, it's a complete ecosystem to help you grow. Now, for this, now what do you see over here? You see this ascending bars, right? That signifies growth. So it is basically, we do not want you to live on your regular income as a job. I'm sure you're doing extremely well, you are successful, but there is nothing like contributing towards education, dental education, and having a passive income. I mean, in the long run, it is going to be helpful at any point in time. So it also helps you to reduce financial risk and increase your wealth building potential. Now, we have a very transparent revenue sharing model. You have an easy to track system. You will see the screenshots, you will know what I'm talking about. You will have a very easy to track system. You will know how it works, what are your withdrawals, how much you have made, how much is your course made, what are your analytics of the course, everything you will know on your dashboard. Okay. So what we need is, we need you to symbolize this. You always should reach for growing income. And what should happen is, you should have multiple streams of wealth. So this is what that signifies. You should have multiple streams of wealth contributing towards your main income. So this is why we are having this, so you get to earn as well. Now, the last is, it illustrates what? Passive income. As money comes in automatically. Now you must be thinking, okay, it's a lot of effort. Okay, it is going to take time. Yes, it will take time. Like I said, nothing is built overnight. We need to go step by step in this process. Maybe your effort put in now is a lot, but over the long run, this is going to be beneficial for you. So this will create a passive income for you. Later on, you don't have to trade your time for this. You do the effort now, right? Now, moving on. Now, why IIDR? Because it's your trusted partner, reliable ally in dental education. We emphasize credibility, suggesting consistent quality, and trustworthiness in delivering online content. Okay. It also offers you world-class instructors, so global network. Again, we have expert instructors from all over. You can also connect with them. It will be a very good way of, having more opportunities professionally. You shape your future. It leads to evolution of dental profession. The goal is not just education, but also you influence and you innovate, come up with newer things, and with dental practices globally, not just in India. You also improve outcomes. You enhance patient results. Come on, the more we learn, the more we get updated, we are more skilled. Probably you never knew all the nitty gritties of composite and how does it work, how do you do a filling. Probably we were only half baked knowledge sometimes. So you upskill yourself continuously. This is very important. We need to be improve our patient outcomes more than anything. Now, next, call to action. We schedule a meeting, we discuss potential collaborations with you. Okay, you can explore our resources. We are here to help you. You have to take the next step. It is not us, it is you that has to take. You can become a part of this leading global dental institution. Okay, you collaborate to advance dental education by coming together. So yes, definitely start today. Let me know if you all have any this. Now, we are coming to the bit of how would your dashboard look like. Okay, these are visuals of your dashboard. I'm going to take you slide by slide. There are 5 or 6 slides. So let me take you through how your dashboard would look like. Now, suppose you enroll as becoming a speaker, you would be approved by IIDR. Then this is how your dashboard looks like. A lot of you have already taken our courses, so you know this is how your profile looks like. You will have your profile icon here over this at the side on the right hand side. This is all your courses. You can see become a teacher tab. You click on that and then the approval comes to our backend team and then we approve you. So this is the first home page. This is how your dashboard would look like after you become a speaker. Now, you have courses, my courses, co-instructor. Co-instructor means my courses is whatever you have enrolled for or whatever you have created as well. Okay, co-instructor, wherein you have been co-instructor on certain webinars maybe, or in the course you have collaborated with another doctor, so maybe you will come as a co-instructor. Okay, and so will that doctor. This is your withdrawals. I will show you how it looks like. All the certificates that you have taken on IIDR or whether you have generated for your course. Okay. We have quizzes. Gradebook you can ignore for now. Quizzes wherein you create your quizzes or the quizzes that you have taken under the courses. Okay. So now we go on to the next. Now see, you can also see published courses. Now this is our admin. This I just took an example. So we have published say 9 courses. So if you have published 9 courses, it will show like this. You will have student completed information like 5, the enrollment, how many students are in progress, completing your course, pending. Total students enrolled for all your courses would be 14, and all the courses together are 24. So this is how your dashboard would look like. Moving forward. Now, this is how your withdrawals look like. Now, see, you can see that this is, I have created just to give you an idea, this is how it would look like. Your commission would look like, depending on how many courses your students have purchased, whether you are referring someone or whether you are promoting it, that is not a problem. You would get compensated for it. So you can have your withdrawal history. Suppose you withdraw this money, you will have that history here. The withdrawals will come here. So this is how your dashboard would look like. If you are just a participant or a subscriber, you would not have all these tabs. Now, moving forward. See certificates, like I said, either you have created for your course, this is for oral biopsy, or maybe you have done this course and this is a certificate that you have received. So this is how it would look like online, okay? Next. Obviously, if you create a course, this is one of the tabs wherein the quizzes that you would have taken, all finish, pass, if you have failed any. So I'm sure you're aware of this, especially a lot of doctors have taken our courses, so you would know how this looks like. Now, this is important for you. This is where you as a mentor or as a speaker would be contributing to the platform, right? Or to, in general, you're contributing your content. Now, this is a front end editor. It's very easy. It is very simple. It's very easy to maneuver. We are always there to guide you, but I'm just showing you how it works. Now you can see over here, just move this a bit. Okay. Now these are the courses that have been created. Dental assistant training. Now total 22 students have enrolled. This is a laboratory technician course where 6 students have enrolled. Dental assistant training program. Teeth whitening boot camp. 3 of them have enrolled. So you will get to see how many students are there. And you will go to add course. This is where you will upload your video, your PDFs, your documents, whatever you need to upload for your course. Now, probably you will have a 2-hour long video wherein you are explaining about, say, removable partial denture, and you have certain checklist or guidelines where you want doctors to follow. So then you will upload them in these ad courses. Okay. So I'm going to move ahead. Also, you will have the month and the year wherein you had maximum sales. There will be a graph, there will be entire analytics to this page. Okay. Next. So you go to add course. When you go to add course, very simple. You add your title. And this can be edited at any point in time by you or by the IIDR team. In case you do not know, you can also leave it in a draft. You can see on top there's a small thing called save draft. You can leave it in that as well. Then our team will do the rest. Okay. So you enter your section title. Okay, and there are some additional settings. See, title, description, what is it about? Simple, you just type, you have some bolding here and some formatting features. You can put your course category. It's a course, okay? You're giving it with certificate, without certificate. What are your tags? I mean, is it ortho? Is it endodontics? Is it implantology? And featured image, you don't have to worry about it now. We have a graphic designer. We can get them designed and upload it for you. So if you have created a course, you can just get in touch with us and I will make sure that all your details of your course is updated. Okay. So this is the general settings. Now, obviously, a course is not a course without a review wherein you know your progress, how you have done. So in that case, we have a quiz section wherein you can put your simple questions. You can put the title of your course, removal partial denture, for example, the description. You can add questions. See, enter a new question, true or false, what kind you want, select questions. So it's very straightforward. It's like using probably PPT or something. It's very stepwise. So this is how you create a quiz. You don't want to put a quiz, not a problem, but it would be really nice if you could include a review for your course. Next, don't worry about these settings. These are very general settings. You can put them, we can put them, not a problem. It's like, how do you want your course to be accessed for? Lifetime access, or 2 months or 6 months or 1 year, 2 years. and whether you want that course available for doctors to buy again or you block it. So those kind of thing, and you can put your levels here. What difficulty level? I mean, is it only MDS doctors need to do, or is it for beginners? Is it intermediate level? That kind of thing. So we can even put all those details here. Okay. And you can also price it. There's a pricing there as well, so you can price your course. You can price it as you want, what you think is that content worth. We have courses from 1500 to 15,000, so you can decide how you want to gauge it, right? It can be 1 week course as well. It could be 4 hours a day content as well. It could be 100 hours content. It's all up to you. You can make a series, you can make only one topic, or it's up to you. Yeah. Now, success stories. I really love this part. Testimonials. I have doctors who come back to me with feedback, some good, some bad. We take them both. We do have doctors who came for our workshops. We have been organizing them. We are coming up with one more oral surgery workshop in September. I'll keep you all posted. So it's on oral surgery, socket preservation, and how do you keep the socket before your implant placement. It's a very nice. You'll be doing hands-on as well. So I'll keep you posted about that. We had doctors who have had good things to say about our courses. We had full batches for teeth whitening, implantology. Also, we already have doctors who have mentored on our platform, who have contributed to courses. We have Dr. Pooja Chaturvedi, who has done a post and co masterclass. We have Dr. Sabah Hassan, who has done the removal partial denture masterclass. So these doctors have been with us for 1 or 2 years now, and they've been constantly contributing to IIDR, and we are extremely grateful, extremely grateful. Now, thank you for listening for at least half an hour patiently. Do get in touch with us. Let me know if you have any issues, you want to ask any questions, you have any doubts, you ping us. You have my number as well. We can chat. If you want to know how it works and everything, what are your compensation plans, how do we go about that? We can all do all of that. So any question, doctors? Do we have any questions? We take questions now. In the meantime, I'll put the oral surgery workshop for you. It's happening in Mumbai on September 13th. While you all are typing your queries, if you all have any questions. So there are two things that are lined up for, one is July, wherein we have our dental photography online lecture. Doctors, you all requested for online lecture after offline last time. So I'm come up with online lectures. So please avail them. You can definitely, make the most of it. If you could not attend our offline workshop for photography, please attend. It's a certified course. We dispatch the certificates, the physical copy of the certificates to your registered address. So do let me know if you're interested. It's on July 20th, 2 to 4 p.m. in the afternoon. Okay, and we'll share all the meeting details with you 2 days prior to the actual date. Okay. Now I'll just put, yes, Dr. Bharti, I seen your question. I'll just put the thing ahead first. Someone's joining now, has missed the session. It's on 13th September, doctors. It's not 6th. It's written 6th on the creative, but it's not, because 6th is Ganesh Visarjan, and we're not going to keep it that time. I will also give you a small detail about what the workshop is cover. Yes. So these are the two things that have been lined up for this year. So please make the most of it. Okay, do not miss it. Okay, now we'll go to questions. How to increase footfall in clinics? Footfall in clinics. See, I personally believe that a clinic's growth and revenue is only through word of mouth. If you do good work, you definitely will have a good footfall in your clinic. So it is very important for you to take testimonials from your patients. Also, uh, do good work. Do good work. Give that that personal touch to your work. I'm sure any patient will come back to you. Yes, you need to have a digital presence online. I feel it is very important at this time that you need to be digitally active. A lot of doctors say, nahi, mera chal jata hai. I don't need to be on social media. Why do I need? No, I think it is required. A lot of people will just come to know about you and will not realize you are in the neighborhood and we missed out on such a good doctor. So please be digitally present. Post your cases. Post your cases, take good photographs. There you go. You can enroll for our online lecture and take good, document your cases well. Take good, document your case as well, showcase it. Everybody appreciates nowadays, everybody knows how to what everything, what kind of treatment procedures involve. So word of mouth, and yes, good little bit of digital marketing. You don't need to spend loads on digital marketing, you can do it yourself. I'm telling you, once, see, I've learned many things after joining IIDR. I'm a core practitioner in clinical practice, right? So digitally, everything for me was very new, but I got to learn so many things. You get to know how to work things out. See, by even if you create a course content, maybe that may work out, may not work out, but you will get to know how to work on these systems. Yeah, you will know how. Like I just showed you those slides. You will get to you will increase your tech savviness, I feel also. So maybe just for you can have something good in mind, contribute, just contribute. People will only learn from your sessions. It could even be a half an hour video, on maybe you have good content, crisp content, like why maybe implants fail, or maybe how why composite fillings fail, how do you rectify those. It could be a crisp 20-minute video, but you can have a course on it. I mean, nowadays people do not want to know how to do composites or how to do implants. They all know, they want to know how to deal with failures. So I guess you should think about that. Anything else, doctors? You're most welcome, Dr. Bharti. As of now, compensations are 50-50, but it really depends on the pricing of your course, how it works. So let me know. The marketing ads are run by us. We do not, that is our thing, expense. So because we run ads on all the courses that we have created. So that would not be a thing for you to worry about. Anything else? For those who joined late, we have our next session on Sunday, temporary anchorage devices in orthodontics. So please join us. I have put the links. And then they're free to attend. You just have to put in your earplugs and just be connected online. All right. I think we have no more queries. In case you have any other questions, you can please get in touch with us. We'll be very happy. You know our email and contact number. Let me know. In case you have any queries, you can get in touch with me also. I'm putting my number. Okay. Any queries, I'll be happy to help. I'll be happy to connect. Okay. Thank you so much, doctors, for joining. I know it was not clinically related, but thank you so much for your time. I appreciate it always that you give us time. Hoping to see you on Sunday. All right. And I'll end the session now.